All right. Welcome back to Line for Line. This is your very special host, and I have a great guy in the building with me today, Dr. Muhammad Bilal Abid, a former leader of mine. I don't know if I would be half of the guy I am right now without being his former assistant. Times changed. I had to relocate back to Kenosha. I'm under great leadership there, and I'm just glad that I can still stay under your leadership as well, even if it is from a distance. How are you doing today, Dr. Abid?
Good morning, Devon. I'm doing very well. Thank you for your kind words.
Yes, sir. Thank you for definitely coming on the show. I actually thought I was working with a celebrity today, and when you agreed to do this episode with me today, man, just tell me a little bit about yourself. How are you feeling today? Tell me a little bit about your credentials as well.
Well, thank you for having me, Devon. Other than the snowy and the gloomy weather, I'm doing pretty okay. I had plans earlier to take my daughter out for a ride and kind of see what's going on in the city,
Uh huh.
but that may not happen. Uh, anyway, so I grew up in across four continents. Primarily, I was born in Pakistan, and then at a very small age, I moved to America for earlier education. And then, because of my dad's profession, I had an opportunity to travel the world and live and kind of experience the vibe of different cultures and societies as I grew up. I lived in England, I lived in Singapore for a substantial amount of time. I partly grew up in Pakistan, and I lived across, have spent substantial amount of time across four different states of America.
Yes, sir. Tell me about schooling, early schooling life. What was it that made you decide to become a doctor?
Well, I think it was really early intrigue, scientific intrigue that I might have had, primarily really stepping in, and really stemming from my mom, who was a non-practicing microbiologist.
Okay.
She got a microbiology degree and ended up raising three extremely mischievous boys, the biggest one being me. Uh, so I wanted to kind of take that step forward. I learned her passion about microbiology that she wasn't able to necessarily pursue as a profession, but I had that background, and then when I started college, I got even more interested in immunology, microbiology, and science really.
Uh huh. Now, infectious disease. Now, that's how I had the pleasure to meet you. Obviously, I was your assistant in infectious disease clinic here at the medical college. How would you say that plays into everything that's going on right now, per se, coronavirus? How do you use your teachings and your progress with that?
So that's a great question, Devon. Really, infectious disease is a specialty uh, that spans across all medical subspecialties of internal medicine, specifically, and the practice of medicine in general. Really,
Hmm.
an infectious disease doctor need to have a good solid background of bread and butter internal medicine, and then he's ought to have certain level of understanding about several other specialties. What makes an infectious disease specialist really distinctive is that he, while trying to understand how an infection might have occurred in a specific patient, he takes a deep dive into the patient himself.
Hmm.
He understands not just the bodily mechanisms. An infectious disease clinician ends up learning about that individual as a human being also. And not uncommonly, many infectious disease clinicians create a very longitudinal and a very uh, affectionate bond with their patients as well as their families.
Hmm. Patient care is definitely number one, especially with everything going on with the
Yeah.
coronavirus. I myself, I have to sit with patients' families and
Mm.
definitely give them a better understanding of what to expect going home if the patient does not go home, what to expect with their everyday life while still being in the hospital as well too. So I definitely love that. That's a big thing of my job as well with patient
Uh,
and family engagement as well too. So
Got
Now,
it.
leading us into the questions, I got a good chance to read your article in the Milwaukee Courier newspaper, and I was
Mhm.
really impressed. When I originally saw it, I was like, wow, I know that guy. Like, I worked closely with him in the clinic here in Milwaukee, and I just had so many questions to ask from your interview, if that's okay with you. So, my first question is
Sure.
about how much longer do you see the American people having to deal with being at home and dealing with coronavirus?
Well, Dewan, that's a great question. Really, uh, it's it is not possible to predict future. However, with we did see that the virus hits the Americans hard in earlier part of spring, moving on to summer.
Mhm,
Now, and then it affected different state at a different rate of transmission. Really,
mhm,
started out very early with Washington State, particularly the city Seattle,
mhm,
and then moved all across several different states, across larger, densely populated cities. And then when mitigation strategies became more prevalent, people started do the basics right. I
mhm.
always circle back to them, really. The four basic things that we can certainly talk about as we talk more. The rate of transmission really kind of plateaued, and we were able to flatten the curve to a certain degree until the most recent resurgence, and that might have happened due to increased social activity and resulting in the rebound. So to answer your question, Dewan, history is the best teacher, and history allows us to gauge what future holds for us.
Mhm.
So the way we behave and the way environment behaves around us, both reacting to one another, both in entities, really shapes our present and predicts our, the really only way to predict future.
Yes, sir.
So it's imperative. I want to say it's imperative that we really give a thought to what we do today, because that's going to be defining our future.
Yes, sir. So every day is a new learning process with this.
That is exactly what I want to say.
Yes, sir. So my true question is, how prevalent is it that the disease is killing off of people? Now, when I say that, I mean in my dealings working for Dr. Habel, a pulmonologist at Freighter South down the road, we see that the people who are losing their lives and succumbing to this disease, they have really bad comorbidities, whether they have scarring of the lungs, really bad COPD, their lungs are really just destroyed from years of smoking as well too. How can you speak on that? Because people are losing their lives from it too, and you notice the trend that there are comorbidities there.
Well, certainly, and we certainly know about the disease and the mortality, which is the death rate associated with the disease itself, more than we did back in the spring or early summer.
Hmm.
We know that patients who are above a certain age, who have certain comorbidities, which means other medical conditions, particularly related to lungs, folks who have a compromised immune system, for example, folks who may have cancer, folks who may have autoimmune conditions, autoimmunity, their own body immune system really fighting against themselves. Those are the individuals, or folks who are on medications which suppress the immune system, such
Hmm.
as transplant patients. Those are at a particularly high risk.
Yes, sir. Yes, sir. So now, as reading your documentation in the Milwaukee Courier, I noticed that you spoke on the disparities that some people face, minorities do face in healthcare. Can you better explain how there are disparities that are still prevalent between minorities and receiving health and going to healthcare facilities?
Absolutely. So there are two tangents to this answer, really. One is that COVID-19, the pandemic of COVID-19, has exposed to a certain degree certain pre-existing healthcare disparities among racial and ethnic minorities,
Hmm.
underrepresented minorities.
Yes, sir.
That's one. Now the other part way of looking at it is uh, working from home is a privilege, is really a privilege.
Mhm.
It's not something that everybody has the ability or the capability or bandwidth to exercise. I
Mhm.
wish it was the case, but unfortunately it's not. That's just a hard reality of the culture and society we really live in.
Yes, sir.
So coming back to the first point is we know that an African American male which is younger than a certain age is or belongs to a certain neighborhood of a certain socioeconomic status is more likely to be incarcerated, is more likely to die early, is more likely to develop certain illnesses early,
Mhm.
as compared to the counterparts belonging to other ethnicities and races.
Yes, sir.
So that's something that has been there and we've already known this for a number of decades now.
Yes, sir.
We when we take into account that some of these essential workers which are unable to work from home belong to these underrepresented ethnic and racial minorities,
Uh-huh.
such as mailmen, postmen, sanitation workers, uh, some of the other jobs that which are considered absolutely essential.
Mhm.
Um, they have to be at work in person every single day. They are more likely to take public transportation
Uh-huh.
rather than in a personalized vehicle. They're likely to have multi-generation households, which makes it hard for them to practice physical distancing, social distancing effectively.
Yes, sir.
So all of these factors really come into play and create and actually make the cleavage in between in healthcare disparities more apparent as we move forward.
Yes, sir. Now, I do have a question for you as well, but I do notice we just got a notification on the Line for Line podcast Twitter from Tracy Kopp in Kenosha. She says there are people who are forced to work from home. How do they feel comfortable if they do work from home for a prolonged period of time while having job security? Because they may say, "Oh, well, we found someone over here who could do the job for a cheaper rate. So should we let her go and have them do it at a cheaper rate if she is forced to work from home for a prolonged period of time?"
Well, that's Tracy. That's a good question, and that's something that I would feel that is unfair.
Mhm.
To me, every individual should have the the bandwidth, the authority to be able to work from home,
Mhm.
or if the job mandates to be in person.
Yes, sir.
If they are required to be in person for a specific designated role, then the employer needs to be making arrangements for who's going to be taking care of the baby, who's going to provide childcare,
Mhm.
how is the husband going to be taking. So there are certain collateral stuff that needs to be done by the employer. And in this, as we all face these unprecedented times, I think the onus is really on the employers and businesses and job owners to really provide this to and very equitable opportunities for uh, all employees, regardless of gender, age, sex, ethnicity, or race.
Yes, sir. So my next question is, let's say I were to come down with COVID. How would I take extra precautions while living with my girlfriend Elizabeth or my daughter Elena? How would I take those precautions to keep them safe if I come down with COVID, but they may not have it? How will we take those precautions while living in the same household if I were to be COVID positive?
Oh, in that case, any person who tests positive for COVID, regardless if they have symptoms or not, they should isolate themselves. Um, there are clear guidelines on this by Center for Disease Control,
Uh-huh.
CDC of America. Uh, you need to, within the household, there's got to be a dedicated space, a bedroom for you with a dedicated bathroom inside that you have access to,
Yes, sir.
and that is not shared by other individuals who are healthy. As much as possible, it's clearly easier said than done,
Yes, sir.
but as much as possible, there should be no physical contact. There should be at least 6 feet spacing of at least 6 feet, and as long as you have passed 10 days from your initial test,
Mhm.
uh, and you have not had any fevers or any kind of fevers without using, if you do develop any symptoms, if you've not had any fevers for at least 24 to 48 hours without using fever reducing medications, you should be okay to de-isolate yourself, to come out of isolation.
Mhm.
So 10 days is really the period for someone who has COVID-19.
Yes, sir. So I know a lot of the listeners at home, they may not have a two bathroom house. So what are ways that we can clean up properly if we only have one restroom that we have to share with those healthy ones? Like how long would you say we should wait before the next person goes in the restroom after us after we've used the facility?
So that certainly is a very good and a very practical question, Dewan. Um, uh, Clearly, once the person, this is an unfortunate situation, but a very practical one. There certainly are many households which are facing the current situation. So, if the bathroom has to be shared, the person who has the infection, he uses it. He must make he must make sure that he has wiped the bathroom down as thoroughly as possible, and there's got to be a lag time between this usage and any subsequent usage by other individual who are not infected. At least, there's no time frame on it, but the longer the better, but a minimum of at least 30 to 60 minutes, and that'll just allow any kind of fumes, any kind of aerosolized particles that might be in there to settle down to the floor that
Mhm.
may contain the virus.
Yes, sir. So my next question is, what would be the greatest piece of advice that you would give to those listeners at home who are really feeling tired of being cooped up in a house per se? Let's say they want to return to their normal lives. They still want to go to the gym. They want to live that normal life and feel sane and not feel like a caged bird, if you will. What would be your best piece of advice to give to them on how to maintain a sense of stability, if you will? Because if you think about it, for me, just speaking for me, the gym is very prevalent in my life. If I miss a couple of days from the gym, I don't feel like my normal self. I'm like, oh, well, I really need to get this sweat in. I really need to go on a treadmill run. I feel like I'm gaining weight because I'm not working out. I'm eating more if I'm just stuck in the house. What would be your best piece of advice for that, sir?
Well, COVID-19 fatigue is real. We need to first acknowledge this, and we need to acknowledge this. Uh, it's fatigue is real. People want to do things, and they're unable to do things that they normally did. Life really changed for everybody.
Hmm.
Uh, but really, the only way to beat the pandemic, to defeat the virus, is to all come together and do our part. We
Yes, sir.
just got to keep going, support each other through these tough times. Now, we can certainly do our best to stay as normal as possible by just circling back to the basics. Wash your hands as frequently as possible, wipe down frequently touched surfaces, cover your face and mouth in a mask all the time,
Hmm.
and maintain at least 6 feet of distance from any other individual. Now, all these things apply to gym also, places of worship also. It's best to do engage in exercise and social activity outdoors.
Hmm.
But with this kind of weather, we understand in Wisconsin, it may not be practical. It is certainly not possible.
Yes, sir.
Indoors, if you're using a set of dumbbells, if you're on a bench, if you're doing a bench press or something, before use, wipe down. After use, wipe down. There's nobody around you when you're using a specific equipment. There's nobody around you, within a certain radius. Let's say at least 6 feet. You This is a time when then you may not need to be tag teaming or may need a spotter, while you're working out.
Yes, sir.
So these are some of the things that you could do, after each exercise. 3 sets down, go wash your hands, and keep your gloves clean, keep your equipment clean after each gym session stuff.
Yes, sir. I definitely feel that too. So my next question to ask, with the vaccination coming more prevalent and being more real, how do you feel effective that can be, and how do you feel that will impact us as American people?
Well, I think this is very exciting that the two messenger RNA based vaccine, which are actually almost getting rolled out as we speak. Um, this is exciting. Now, both the vaccines have shown, the two doses of each one of these vaccines have shown an efficacy of not, in excess of 90%. One of them approaches up to 95%, really,
Hmm.
after two doses. So this is really exciting, which clearly means that anybody who gets two doses of this vaccine, uh, 95% of those individuals will develop antibodies that will
Hmm.
protect them from an active COVID-19 infection. So the data is really exciting. Thousands and thousands of people have received these vaccine as part of phase three clinical trials through all these that are in the pipeline to get approved,
Hmm.
either now or in the near future. These are safe. There's been no toxicity signal. There's no safety concern. By the time these vaccines are distributed to general public, these will have undergone high standards of safety and regulatory approvals based on results of research conducted on thousands of individuals. Really, um, uh, this is exciting. I strongly encourage everybody to consider receiving vaccine if they're offered.
Yes, sir. Now, my biggest takeaway from that part is working in healthcare and just being an American. America's really good with their vaccinations. If you look at everything that they were able to knock out measles, mumps, rubellas, and everything like that. I'm pretty confident in this vaccine being able to be very effective and help Americans get back to like a normal life. Granted, we still have a lot of work ahead of us as well too to move into the new year. We're in December now. The new year is getting ready to start, so I just really wish people at home don't feel discouraged. Just hang in there. That could be my best piece of advice. Healthcare is doing their great job. Heroes are still working in healthcare every day to ensure that everyone's being safe, and we're doing our best to save lives. Because I know I've been working extra time at the hospital to assure safety of patients and really dealing with COVID patients as well too. So I'm just really thankful that we've come together as a people to create this vaccine, and I'm ready for it to like start being distributed.
I love what you're saying, Devon. I love each word you said, Devon. There
Yes,
you
sir.
are, man. We need to be exactly what Devon just said. We need to be together.
Yes, sir. Now, as two healthcare officials, how would you say that we can do a better job? Obviously, we still have to go to the hospital. We may be in the ICU here, or we may be in the ER dealing with patients. How would you say we keep ourselves safe if we're put in positions like that where we're coming in contact with patients who may have COVID infection or coming off of a COVID infection?
Well, on a personal level, Devon, I'm sure you appreciate that this has been a hard year.
Hmm. Oh my
Particularly
gosh.
with every time I was walking into the ICU, to see a patient who had COVID-19. I knew what you know, I was getting into. But as healthcare professionals, this is what we do.
Hmm.
This is really what we do. This is our moral authority, not just an obligation, but this is something what we do from our heart. We want to give back to the community. We want to be there when the community needs us. And I do greatly appreciate, Dewan, that you've been a part of, integral part of the team through and through. Doing this fantastic job with putting Kenosha out,
Yes, sir.
on the scene, and trying to bring out the real issues from the streets. Not a lot of people may know that Devon is a fantastic healthcare worker. We all know
Appreciate it.
at the Mecca College the services that Devon has provided over the last number of years. So clearly, I think we it's anxiety provoking on a personal level, but I mean, one just got to be brave um, and exercise as much caution as a healthcare provider can. We all know what we're supposed to be doing, and that this is really not the time when to let our guards down.
Yes, sir. Because when this first hit, I was extremely scared because you'll see doctors even like taking precautions, and you're like, I don't know if you really need to do that, but it was really scary. It's still so new with it you having to do research every day. It's a like I said, it's a learn as you go type of ordeal. And I just wish that everyone stays safe and remain humble. And I just want to say that I'm thankful for having your time for this episode, sir. Giving the people what they want about coronavirus, because everyone's been asking me, when are you going to speak on COVID? When are you going to speak on COVID? And that's when I said, oh, well, I really have to bring in the big guns such as Dr. Abid to better speak on that as well too, because you went through much more extensive training and schooling than I. So I definitely feel that you are the right person to have on the show. And I just want to tell the people at home, this is a great guy, great doctor, great physician, great friend, great father. I really look up to this guy. I don't know if I would have half of the motivation I have now if it wasn't for Dr. Abid. So I really just want to say thank you as a friend, an assistant, and as a colleague, sir.
Well, I appreciate you having me, Devon, and such kind words. I mean, beauty lies in the eye of the beholder. So, Devon, thank you for having me again, and good luck with the fantastic work you do.
Yes, sir. Line for line podcast trailer. Please go to YouTube and watch.